and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman, and here is what I bring to you all from the world of medicine. Tongue and lip piercings and their effect on dental and oral health. Oral piercings should be removed to save teeth and gums, urged dental professionals displaying an e-poster at Euro Perio 10, the world's leading congress in periodontology and implant dentistry, organized by the European Federation of Periodontology. It's estimated that approximately 5% of young adults have oral piercings, with the tongue being the most common sight. Women are around 4 times more likely to have an oral piercing than men. A systematic review collected the best available evidence on piercings and oral health. The analysis included 8 studies with 408 participants who had a total of 236 lip piercings and 236 tongue piercings. Every 5th patient had piercings in more than one oral site. Wearing duration varied from 1 month to 19 years, and most jewelry was metal. The studies compared teeth and gums next to the piercing with teeth and gums elsewhere in the mouth. Regarding tongue piercings, 3 in 5 studies found deeper pockets around teeth next to the piercings, while 3 in 4 studies observed wider gaps. All 4 studies that examined patients for receding gums found this problem in those with tongue piercings, while 2 in 3 studies found bleeding gums. As for lip piercings, the main finding was receding gums, which was observed in 3 out of 4 studies. Researchers said that the findings suggest that oral piercings, especially in the tongue, negatively affect the adjacent teeth and gums. In those with tongue piercings, damage was particularly notable around the bottom 2 front teeth, called the mandibular incisors, which are important for biting and chewing food. The likelihood of tooth and gum damage appeared to increase with the duration of wearing a lip or tongue piercing. The authors concluded that dentists must take an initiative and should inform their patients about the risk of periodontal complications when wearing oral piercings, and people with these piercings should be strongly encouraged to remove them. New implantable nerve coolers that help in managing pain. An implantable device designed to cool nerves can provide targeted, on-demand pain relief, researchers reported. When tested on rats with neuropathic pain, the device produced highly localized cooling. One such approach for pain management is analgesic nerve cooling, which holds promise as an effective and reversible way to alleviate pain, including after amputations, nerve grafts, or spinal decompression surgeries as examples. Like putting ice on a sore joint or muscle, targeted application of cold temperature directly to nerves can block the conduction of pain signals, providing temporary relief. Conventional nerve cooling devices are bulky and rigid with non-specific cooling and high power requirements qualities that prevent practical clinical use. To address this, researchers developed a soft, miniaturized and implantable nerve cooling system based on state-of-the-art microfluidic and flexible electronic technologies. Borrowing from electrical nerve cuffs from previous studies, researchers used a liquid to gas phase transition within microfluidic channels in an elastic band that wraps around peripheral nerves to provide targeted cooling. An integrated thermal thin film sensor in the device provides real-time temperature monitoring and control. Since the device is made from water-soluble and biocompatible materials, it is bioresorbable, meaning it degrades, reducing necessary surgery risk. To demonstrate the device's ability, the authors performed in vivo experiments in rat models of neuropathic pain, rapidly and precisely cooling peripheral nerves to provide local and on-demand pain relief. Besides the demonstrated strengths of the miniaturized flexible cooling device for pain mitigation, the technology presents further opportunities for neuroscience research and neurological practice. An implantable cooling device with on-demand local analgesia will be a game changer for long-term pain management. It offers a promising path toward creating a class of analgesic devices for long-term non-opioid pain management, concluded the researchers. New smoking cessation drug varenicline in diabetic people. Evidence of effective smoking cessation interventions in patients with diabetes is limited. The unique behavioral and metabolic characteristics of smokers with type 2 diabetes to justify the recent trial of the smoking cessation drug varenicline. A randomized clinical trial in JAMA network involving 300 patients with type 2 diabetes who smoked found that this drug was efficacious at weeks 12, 24, and 52 of the trial compared to placebo. Nausea, insomnia, abnormal dreams, anxiety, and irritability were reported at higher frequency among patients in the varenicline versus placebo group. No treatment-related serious adverse events were noted. The multi-center, double-blind, placebo-controlled randomized clinical trial recruited patients from 6 outpatient clinics in 5 hospitals in Catania, Italy. Patients with type 2 diabetes who were smoking at least 10 cigarettes a day and who intended to quit smoking were screened for eligibility. Eligible patients were randomized to either varenicline or placebo treatment. The trial consisted of a 12-week treatment phase followed by a 40-week follow-up, non-treatment phase. The primary efficacy endpoint of the study was the continuous abstinence rate, that is CAR, at weeks 9 to 24. The CAR at weeks 9 to 24 was significantly higher for the varenicline than placebo group. The CARs at week 9 to 12, that is 31.3% versus 7.3%, and weeks 9 to 52, as well as the 7-day point prevalence of abstinence at weeks 12, 24, and 52 were also significantly higher for the varenicline versus placebo group. The most frequent adverse events occurring in the varenicline group compared with the placebo group were nausea, insomnia, abnormal dreams, anxiety, and irritability. Serious adverse events were infrequent in both groups and not treatment related. Results of this trial showed that inclusion of varenicline in a smoking cessation program is efficacious in achieving long-term abstinence without serious adverse event. Varenicline should be routinely used in diabetes education programs to help patients with type 2 diabetes quit smoking. How people with obesity are less likely to take flu vaccines and have reduced benefits, although the reasons for this are not well understood. COVID-19 vaccines greatly reduce the number of cases of severe COVID-19 disease for everyone regardless of their body size, according to the new study published in the Lancet Diabetes and Endocrinology. Vaccine's effectiveness was similar for those with a higher BMI and of a healthy weight, but slightly lower in the underweight group, who were also the least likely to have been vaccinated. In a further analysis of vaccinated people only, among the fewer COVID-19 cases recorded, people of very low and very high BMI were more likely to experience severe disease than vaccinated healthy weight people. This replicates the findings seen in previous analysis before the vaccination program commenced. Researchers searched anonymized health records for more than 12 million patients across 1738 GP practices in England taking part in Q Research, a secure database of healthcare information available to verified researchers. Of these, 91,71,524 patients who were over 18 years old had BMI data, had not previously been infected with SARS-CoV-2, were included in the study. People were grouped based on their BMI according to 4 World Health Organization definitions of 18.5 to 24.9 kg per square meter for healthy weight, below 18.5 for underweight, 25 to 29.9 for overweight, and 30 and over as obesity, with levels adjusted for Asian people to reflect the higher health risks at lower BMI levels in this group. Characteristics such as age, sex, smoking status, and social deprivation were also accounted for in the analysis. Out of the 9 million people at the end of the study period, 23.3% of the healthy weight group, 32.6% of the underweight group, 16.8% of the overweight group, and 14.2% of the group with obesity had no doses of any COVID-19 vaccine. In comparison, people in the healthy and high BMI groups who were vaccinated were around 70% less likely to be hospitalized than the unvaccinated people. People with a healthy or a higher BMI were also around 2/3 less likely to die than their unvaccinated counterparts 2 weeks after a second dose. The authors ended that the cause of the increased risk among people with obesity is unknown. It is consistent with the higher rate of seasonal flu infections in people with a higher BMI. They speculate that their findings may be explained in part by an alternate immune response in heavier weight individuals. The reduced effectiveness of COVID-19 vaccines among people with a low BMI may also reflect a reduced immune response as a consequence of frailty or other conditions associated with low body weight. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.